can start when you're ready.
Okay. Um, so the focus of this project that I'll be talking about is really around what our invisible sexual minority women want their healthcare providers to know in terms of their sexual identity and their sexual history. So the kind of prompt for this particular focus was prior research, which has found that bisexual women are actually less likely to disclose sexuality, sexual histories in terms of talking to healthcare providers than lesbian women, and so that's potentially a concern because of the belief that, well, if you're not open about your sexual orientation, this might interfere with your ability to develop a good rapport and a trusting relationship with healthcare providers. So we were interested in whether our ISM group felt like it was important for their midwives and their other perinatal healthcare providers to be aware of their sexual identities and histories and experiences. So our data analysis so far really suggests that actually, first of all, their sexual history didn't really impact their choice of a healthcare provider during their pregnancy, so they didn't specifically seek out, for example, an LGBT-friendly midwife or healthcare provider. A couple of women, though, did feel that it was important to find an LGBT-friendly provider, and a number of women explicitly said that they would have switched providers if they found out or got wind of the fact that their provider was not LGBT-friendly. There were also a couple of women who felt like it's not so important that my provider is, LGBT-friendly specifically, but it certainly would be important to know that about a therapist or somebody who is more sort of, some sort of behavioral health provider, somebody with whom they were talking more extensively about their sexual history. So along with this, most women didn't feel like their sexual history was actually so relevant or necessary as to kind of bring up to their provider. They felt like it would have been perfectly fine if their provider had maybe asked about it, but they didn't feel like it was so important or relevant specifically to their pregnancy and perinatal care as to raise spontaneously. So they cited a certain specific circumstances under which it might be relevant, for example, if they had or suspected they had an STI, or again, if they were seeing a therapist. Many of them, though, did say that it was really important that, again, their providers indicated